we review the patient within the first week after the discharge. That is max a week first time. We have to make sure that the wound is okay, that the wound is healing well, and generally how the status of the patient is. No signs of infection, no signs of any collection, that is just any fluid collection around the lungs or on the heart, which is rare, but we have to make sure. So these things we take care of in the first review. And then adjusting the medications. And by 1 month, they have started walking well, and so the exercise capacity has improved, things have changed. We will really need to adjust the medication after a week, and then in a month's time, and then 3 months' time. And that's the protocol we have here, which works well. Recovery after heart surgery looks good. I would say really good. Depends on what we were doing before surgery. If the patient was playing tennis before surgery, then he can get back to playing tennis and he can probably do it better. He can definitely do it better. Basically, quality of life improves. Patients are able to be more active because the blocks in the heart are sort of fixed or taken care of. They can be really active. And a recovery program really helps. Generally, people are scared what's going to happen after heart surgery, and that scare is actually unnecessary. Once the procedure goes well and the patient is recovered and discharged, generally things are better for them because before surgery they've had the blocks and they should be worried whether they can be active, whether they can strain. But after surgery, they can be active and they don't really need to worry about it. There would be a little bit of pain, just like any surgery. If somebody gets an orthopedic surgery, gets their knees fixed or fracture treated, they're going to have a little bit of pain in the recovery period. Just like that, in heart surgery also, there's going to be a little bit of pain, but on the whole, that's going to come down within about 6 weeks. And they'll be really active and they don't have much to worry about, except being in regular consultation with the doctor for the first 6 months. So heart surgery, contrary to popular belief or prevalent belief that it is dangerous, yes, any surgical procedure, not only heart surgery, it involves anesthesia, it involves a whole lot of drugs. Heart surgery has generally become very safe. In fact, we say it's comparable to air travel because it's highly monitored, just like air travel. So cardiac surgery is pretty safe, and the recovery after cardiac surgery has become much faster nowadays. Patients can get back to the regular activities, get back to work very early. And we have now minimally invasive cardiac surgery as well, where we can even discharge the patient in 3 to 4 days. Even our regular patients get discharged in 4 to 5 days. At least 50% of them get discharged in 4 to 5 days. And so cardiac surgery is very safe. People who have a cardiac problem which needs surgery should undergo surgery because that would be the scientific recommendation and that would give them a better quality of life and in many cases a survival benefit, that's a longer life as well. Thank you.